we feel like our voice is heard more. We're kind of more powerful in essence as a unit. Our voice is heard more. I feel like we could give more information to you. You can tell us things as well. But also saves you time because we're all having the same conversations. If you can drive that down into regions, that will save you so much time. And our point is we can show our baseline and where we're going to progress in future. And that's what I envisage it to be, where we see improvements and we can show it as a blueprint going forward.
Hello and welcome to The Connection, where RLDatix's Chief Customer Officer Liz Jones and Medical Director Darren Kilroy are joined by leaders and colleagues from within the healthcare industry. In The Connection, we explore how people and technology in healthcare can come together to create great experiences and support patient safety. We hope you enjoy listening.
So welcome to the Connection podcast. I want to call it the Connection podcast live, actually, because we're live from NHS Confederation Expo and here in sunny Manchester, inside the conference centre. I'm Darren Kilroy, Medical Director for RLDatix.
Yep, and I'm Liz Jones. I'm the Chief Customer Officer for RLDatix, and we're really delighted to be joined by one of our customers who is also here at the conference. And Aneel, I'm going to get you to introduce yourself and your job title, if I may, to our listeners.
Yeah, no problem. Hi, Aneel Attrik. I'm the People Digital Senior Program Manager here at the Bedfordshire, Luton and Milton Keynes ICB.
The one thing that will always be true is that the health service will never struggle to have lots of words in organisation names or job titles with it. It's
Correct.
Amazing.
It follows me everywhere I go.
Is this your longest title?
No, I think my last one was
Was it?
Head of Workforce Informatics and Planning.
Wow.
Yeah.
And does your title now, is it the biggest job you've ever had?
Yes, in terms of portfolio as well too. I am leading the People Digital Program at the Bedfordshire Luton Milkins, which will bring it to BLMK, and with a focus of improving People Digital, which is your HR systems processes across our partnership. So I work with the trusts in our region, who are fantastic, with a focus of everything towards like ESR, the Future Workforce Solution, but also with my rostering background, one of those important things I want to drive into is the rostering aspect, as well as other things like digital literacy to improve on across the region. So there's a wide portfolio in there, exactly what we're working towards collect.
It's a busy guy.
It is. But it's interesting because when people say people digital, you always wonder how much of that is about making people more productive and how much of that is about creating brilliant experiences for people. How do you balance those two in the work you do? Because you can do both within that portfolio.
Yeah. So there's a lot with that. And I think it's confusing to know what actually happens with people digital because it's a new term as well. And the thing is, I think it's a good one driven by our leaders in the ICB, Bethan and Martha. They've always said we actually don't have everything's about efficiencies. We need to make people more efficient, but actually, it's the systems are there to make you efficient. It's just we need to make them in place to make people more productive, to save time, and that's the aspect that we need to look at the people side of it.
Yeah.
Now this is a busy. Well, think about it. How many people here? Thousands.
9,000.
9,000 people here. So when you come to an event like this, how do you sort of decide what to do with your time? What is the big draw? What are you trying to get from the event here? What interests you the most in the event like this?
So we were kindly invited to be part of the stand for NHS BSA as part of their future workforce solution and how organisations to be prepared for that. So we're hoping to be one of the early adopters for that in 2027, and we're showcasing what we've done as a collaboration as an ICS because we have people digital leads in each of those organisations, and they're working on these tasks together to improve ESR, data quality, as well as that. We look at the wider aspect of it, which I mentioned earlier.
Yeah.
So we're helping them, but also it's so customers can actually talk to customers. I think that's the important part. And then for me, selfishly, going around enjoying other aspects. So I said I want to see other people connect and network. I've seen other colleagues because now my portfolio is wider. I've spoken to a lot of colleagues. I like Power Apps, there's in Microsoft partners and everything else that can make us more efficient, or new technology we can leverage. Especially where I'm thinking we can bring things in and use economies of scale. At Grandon, we've all got the same ideas. I'm probably going to jump on future questions, but we have for example, our strategy we did for our region. Instead of it being ICB focused, we asked our partners to come up with top kind of 4 or 5 they want to identify in the next 12 to 24 months. And I think that out of a possible 20 kind of 425 priorities that could have been identified, 11 came out totally shared, which exactly sums up why we want to do this collaboratively. The sharings are the same. We're going to just talk about the same things. We want to be efficient. We want our staff to be, again, leverage those skills that we hope to develop and the products we use.
And that really interests me, because I know that certainly in the roles you've had in the past, you may have been part of really small teams at times, or sub teams within HR. And I know, talking to others that have done those roles, it can feel kind of lonely. Yeah. Are you part of a bigger group of people now that are networked, and does that feel different to you personally? Or
so you're right, this is a very lonely place. Especially, so I used to look after the rostering function. I also, in part of my role, was workforce, payroll, analytics, all the fun stuff. And you're so driven by the day to day, you miss all these opportunities that come through. And being part of this now, I can see a different landscape. It helps to bring people together because I connect with different people. Our leaders are great. They put our name everywhere. And like I'm here today. So I'm just an open book. I'll go and share and talk to people about our learnings, mistakes as well. That's the key thing. So I was chair of the East of England rostering group before. So that was helpful to see how we connect the rostering part. And I think that really helped me in my new role.
Yeah.
How I could collaborate with people wider scale. So we have people digital leads. We have Milton, Keynes, Bedfordshire Hospitals, Cambridgeshire Community, and East London Foundation Trust.
Yeah.
So people digital leads there.
Really,
also,
really different parts of the world.
It's great because we have community, acute, and mental health trusts. So it's such a great ICS to be part of. And again, be part of that network. We talk to each other and we share a lot. Things like, and we created a new, I'm probably stealing your thunder here later, but a rostering leaders group. So of each of those trusts, we'll start to meet monthly as well to go through those kind of things. Because I think part of my role is to bring people together, just to I can easily see myself what can be achieved. Then it's like, why not just get this going? And sorry, going back to the point is, you're so bogged down in the detail when you're in a trust. You want to make enhancements, but sometimes if I can come along and see where it's done well and tell someone how it's done, they just have a conversation that alleviates so much release dates you have to look at, or you have to talk to customer success and things like
it's personally that, I mean, you can get a kind of sense from you that you're getting a lot of energy from it as well, and you feel like liberated to do more. Changing tack a little bit, especially because, to your point, right, there's so many. I mean, it's incredible, the technology.
It really is,
right?
Yeah.
And and again, I'm showing my age here a little bit, but I think my first one was 20 years ago, and there was probably only about 5 technology companies. It was mostly all pharmaceuticals and then consultancies and legal. So you can kind of feel that shift that, so much of the future is going to be delivered through really innovative technology.
Absolutely.
When you're thinking about your role and how you work with vendors, it doesn't have to be our role by solution. Like, what do you think the NHS has the right to expect from tech companies in the future? What do we need to all kind of like look up to and be good at?
So I think it's that collaboration piece, because and it's that customer centric approach. I really like the as you know, I've worked with customer success here, and it's making sure that customers had, whatever it be, problems, great things that go well. I think that's the important part there. And then also, I think that will also open up space where you could look at opportunities with other vendors. Also, interoperability is the huge point of this. So we want to make rostering, I'm just using an example, talk to other systems and have those in that, so they can actually, that saves a lot of time in streamlining processes. And I think that's the point that customers' voice is heard, where a lot of their things is they want to save time. They know the products are great, and they just want to kind of that advantage from yourself as big tech companies, that you also talk to each other to have things in place before we run into problems like that. Excellent. I think that's easier to say.
That is good, and it is, that's the ideal that we have to, all of us, whichever company has to hold themselves to. So in that spirit of collaboration, you've been working on the Oversight report. Is that the regional one or
the regional one?
Yeah.
So we're working with customer success, who've been fantastic in developing a regional oversight report. So obviously it's great to see that you see all the KPIs internally for each trust, and that's presented to board. But my main objective was, it's great and you can see where you are, but where you are against peers, or you can say internally what you want to improve on, and the gaps, but who's done well? Where do you compete locally? I'm all part of the collaboration. We work together, but also there's a little bit of competition there, which is healthy. To see if there's a trust down the road that's doing better at kind of reducing their towers or anything else. Why not talk to them to see how they've achieved things?
Yeah, because that's it. That's the fundamental, to me, the fundamental of any flux system we're in for. You've got to use partners' experiences to drive improvement, because I know as a medic, stereotypically the worst with this, that you are driven by someone else's performance being better than yours, that it absolutely drives you to do as well as they are. So we should absolutely capitalize upon that. So otherwise, what's the fundamental point of system work on? It's got to be, it's more efficient. Yes, they're saving a cost, but it's got to drive standards.
It's exactly that. So we have like an SLA in place, so we can see the data's not ready yet, but I've seen what it will look like, and where each organization will be plotted on each of the KPIs, which is fantastic. And our point is, part of that, we'll do a collaboration piece where we'll get our RLDatix colleagues to come in, or the customer success, and also specialists. We're product specialists, product managers, to come in and say, actually, we're having a problem with this. Can you help us? And speaking to the expert. And I think this is like a two-way collaboration with RLDatix and us. We feel like our voice is heard more. We're kind of more powerful in essence as a unit. Our voice is heard more. I feel like we could give more information to you. You can tell us things as well, but also saves you time, because we're all having the same conversations. If you can drive that down into regions, that will save you so much time. And our point is, we can show our baseline and where we're going to progress in future. And that's what I envisage it to be, where we see improvements and we can say, we can just obviously show it as a blueprint going forward.
And do you think that because one thing that organisations have been notoriously challenged with is sort of measuring something before, and then measuring it afterwards, and genuinely being honest about the implications in terms of safety and savings. And so you end up with these really big, grandiose statements like, we save millions. Right? How many exactly? Right? Or it's safer. It's what you've often challenged us on. Because what do you mean by?
Like, if you shaved off huge quantum of agency spend, that of itself is interesting, potentially very beneficial, but unless that has come with no net loss of safety and quality metrics, it's making sure that everything's in the round.
You're right. There's narrative to everything that goes on, and it's not just this is what we've improved where. And that's the point, is when we have these conversations, we might have improved something, but because we're talking kind of customer to customer, we could be honest and say, actually, it's not going well because of this, or we've tried kind of self-rostering and it's not gone well. But we've
because it doesn't for every team.
Exactly.
Right. It's brilliant.
Exactly.
It's not,
and I know from our time in Bedford, we had critical care, which were amazing. We've done it for years and years. But in other wards, it doesn't. So we're like, talk about it. For
sure. Exactly.
And that is, we're getting to the end of this now. We carry on. Obviously, it's always the way with us. But that is the whole point about this, the technology and the humanity, because it does so often, no matter how good the data is, no matter how good the workflows are, it does boil down to what conversation 2 or 3
Just
people
does.
are going to have together.
It ends up, it's fundamentally about the why, isn't it? It's the why of it all. Why are we doing whatever project we're doing?
Which is why it's important to interview people like you on this podcast, because actually, a lot of people don't know what the work is that goes on behind the scenes to navigate the data, to have the conversations, to make those connections. And, and yet I know when we speak to lots of senior people, they're always so grateful because you guys keep people on shift right now. Yeah, it's brilliant.
In true social media style, and she'll have Aneel's details down below. Can subscribe. It's been great to see you.
Thank you. Bye.
Thank you for joining us on today's episode of The Connection. We hope this episode has provided you with valuable insights on the role that both technology and people play within the healthcare landscape. For more information and resources, visit RLDatix.com. Don't forget to subscribe to The Connection on Apple Podcasts, Spotify, or any other podcast platform you use. Join us next time as we continue to explore how healthcare is impacted by connecting people and technology. On behalf of the RLDatix team, thanks for listening.